Congregate living at M&T Healthcare means shared bathrooms, shared dining, shared lounges, and shared microbes. When people live and recover in close quarters, a single cough or a missed hand wash can spread a pathogen through a unit faster than a rumor. We establish our baseline defense with standard precautions. The rule here is absolute. Treat all blood, body fluids, mucous membranes, and broken skin as potentially infectious for every patient during every single task. This flowchart tracks the 5 chronological moments of hand hygiene to stop transmission at the source. You sanitize before patient contact and before any clean or aseptic task. You sanitize again after any risk of body fluid exposure, after patient contact, and finally after touching the patient's surroundings. There is no buffer for mostly. M&T's organizational goal is 100% compliance. Every transition, every shift, absolutely no exceptions. Hand hygiene is the single most important measure for a reason. Consistently performing it forces a physical break in the transmission chain right at the primary point of contact. Alcohol rub is fast and effective for routine moments, but it has hard limits. If your hands are visibly soiled, or you have just used the restroom, you must wash with soap and water. This microscopic cross-section shows the C. diff exception. Alcohol cannot penetrate the spore's thick outer layer. You need the friction of soap and water to wash them away. For equipment, use bleach wipes. Keep the surface wet for several minutes to break down lingering spores. This flowchart maps the exact sequence for physical armor. Personal protective equipment must match your exposure risk and be applied in strict order: gown, mask, goggles, and finally gloves. To remove the gear safely, you execute the exact reverse sequence. Selecting the exact chemical for the pathogen and the right physical barrier is the only way to interrupt the chain of infection. We must eliminate shared vectors. A stethoscope used on an unrecognized MRSA infection and then placed on a second client transfers the bacteria instantly. You must wipe down blood pressure cuffs, thermometers, and stethoscopes between every single client use. When standard precautions aren't enough to contain a bug, we layer on transmission-based precautions. These come in 3 escalating tiers based on how the pathogen travels: contact, droplet, and airborne. This decision tree maps TB red flags: persistent cough, unexplained weight loss, and night sweats. Protocol activates immediately. First, mask the client. Second, isolate in a private room. Third, notify the healthcare designee to coordinate transfer. Never enter without a fit-tested N95 respirator. Recognizing these red flags and isolating a resident in the first 30 minutes prevents a localized illness from becoming a facility-wide threat. For injections, the logic is non-negotiable and strictly enforced. 1 needle, 1 syringe, 1 patient. Think about your own muscle memory for a second. What is the single most common, dangerous error staff make after administering an injection? Recapping the needle. Never recap a needle. It is the leading cause of needle stick injuries. Instead, activate the safety mechanism immediately and drop the syringe into a puncture-proof container. This diagram highlights the disposal threshold. Never let that container get past 3/4 full. Overriding the automatic instinct to recap with engineered safety protocols eliminates the primary cause of bloodborne pathogen exposure on the floor. This graph charts how post-exposure prophylaxis for HIV decays in effectiveness over time. It requires action within hours, not days. Hiding an exposure out of embarrassment or fear lets that window close and risks a preventable infection. The exact moment a stick or splash occurs, wash the skin site with soap and water, or flush your eyes for 15 minutes. Then report it to your supervisor immediately. Do not finish your medication rounds first. Within 24 hours, you submit an incident report and visit occupational health. They will establish your baseline testing and initiate any required follow-up treatment. Your daily defense comes down to 6 actions. Use standard precautions for every task. Treat hand hygiene as your most important measure. Match your PPE to the risk. Never recap needles. Clean shared equipment between clients. And report any exposures immediately. Following these protocols reduces the risk for every resident and staff member. It is how you protect the M&T mission, by protecting yourself.